Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 45 to 60 minutes or so discussing one of the key partners that we have at Premier Marketing in the Medicare space that can really help make you a more efficient and more productive and more compliant agent by working with them and doing some of the things that they have to make your business better, plain and simple. The presentation is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel as well. And you'll notice in the software system, as a bit of housekeeping, that there's a section for both questions and chat. We ask that you put your questions in the questions box. We find that we normally cover them through the course of the presentation, but we want to make certain that we address any of your inquiries to make certain that you get full return on the investment of the time that you spend with us here today. You'll also note that the presentation will be broadcast to a variety of agents with a variety of experience. So you'll see some things that perhaps might be a bit remedial for some of you. Some of you, it might be brand new. And for some of you, it might be a welcome review. And with that in mind, let's start with a little bit of level set as to who Premier Marketing is. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We're licensed in all 50 states, working with independent insurance agents such as yourself through contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. We work through a full portfolio of products that include the base Medicare programs, the Medicare Advantage, Medicare Supplement, and standalone Part D programs, but also a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans. Also offer a variety of long-term care and short-term care programs and disability income plans, and a variety of ancillary benefits to help address those specific needs that we run across in many of our discussions with our prospects and clients. That Medicare Advantage portfolio includes the national carriers and many of the strong regionals that can make a difference for you in your market. Same philosophy carries over to the prescription drug programs, where you'll note that most of these are part of the Medicare Advantage contract that you have with the different carriers. A couple of key exceptions. Mutual of Omaha is a separate contract for their prescription drug plan, and Clever RX is a discount program and not a standalone Part D plan. When we look at Medicare supplements, broad portfolio, a lot of programs that are put in place to help you be successful in this space, because we recognize that the Medicare Advantage, the Medicare beneficiaries have a variety of needs, and there's no one correct answer for folks in this area when it comes to their base programs. Ancillary products, in each of the categories, you see the national leaders that are there for you. These are very welcome products for folks that are in need in these special areas, but it also gives us an opportunity not only to address that need, but give us a little bit of different means to market, and of course, create an additional revenue stream for our agencies. When we look at the Medicare market, of course, you don't come on a presentation like today unless you want to hear about the aging of the baby boomers, the silver tsunami, 1 every 10 seconds, 10,000 plus a day. And when you look at people aging in the Medicare, near exponential growth, very large market. But we're seeing an increasing number of people that are accessing Medicare benefits, or becoming eligible, I should say, and not accessing them fully for one reason or another. Many of them are like me, a tail end baby boomer, where we wait till 67 to get full Social Security. So we're going to work a little longer than perhaps some of the folks in the past. But this tempering of that number is more than made up for by the folks that are accessing Medicare benefits because of a disability. A good percentage of people on Medicare fit that description. And when we speak of Medicare Advantage plans, it's a great program to cover those folks because of the no age differentiator in the plans themselves. Huge market. These are some numbers that came out very recently as of November 22nd. So we look at a huge number of people that really need our help, and really need our help working hand in hand with a carrier that can help us service this population. Because folks on Medicare have choices. They don't have to do anything. They can actually turn down Part B. And as we saw for some of the folks that are working past the age of 65, perhaps that's a solid decision. For others, they may take A and B, self-insure for what Medicare doesn't cover as a financial shortfall, perhaps pick up a standalone Part D plan to help with medications. Some will pick up that standardized, modernized Medicare supplement program. Some will bundle their benefits into a Medicare Advantage Part C plan. In each of these areas, we want to make certain that we have choices to help these folks cover themselves to the best of their ability to make certain that the financial ramifications of a major illness or whatever the circumstance may be is lessened as much as possible. And we're able to do so throughout the year simply because folks aren't doing an annual review as they should. Kaiser Family Foundation tells us that the vast majority of people didn't do an annual review recently, and it doesn't matter what their base coverages are. If they're staying on original Medicare or if they're in an MA plan, well, they aren't doing that review. So that brings up the need for us because they're also not using the resources that the government puts on, makes available to them to help make decisions. The electronic Medicare and You document that is sent to folks or mailed to some folks still isn't being fully accessed. Neither are some of the online opportunities that folks have to change or to understand the benefits that are there for them. And so we, as qualified, certified, licensed agents, we want to make certain that we deliver the information that they need to make what may be the best choice for them and translate along the way. You'll notice in this screenshot from CMS's website that, gee, acronyms, 4,420 of them. It's a confusing situation for many people, and that really brings about the need for us to be on our game and making certain that we help people understand the choices that they have. And for us, if we use an acronym, remind us to basically tell people what it means. So we want to make certain that we communicate properly throughout this process. And that includes the delivery of the information that they need to make their decisions. Many folks still want the across the table, shake hands, kiss babies, get elected type of procedure. Some folks are gone completely virtual. The folks that are aging into Medicare in many circumstances, according to Deft Research, are doing a lot of shopping beforehand before they even talk to an agent. So our delivering information to them in the manner in which they feel comfortable is very essential for us in our success. And so we want to work with an organization that markets and has the wherewithal to deliver upon systems that can help you do that. And that same thought process goes into the carriers in which we partner, because folks are becoming much more digitally savvy. And when we hit our senior years, so to speak, you think about it, when the pandemic hit, all the doctor's visits were digital. Primary care specialists, prelim work for hospitals or dentists, all online or digitally handled. Even things that make up part of our life, our celebration of our faith, were all done digitally. So this gives us the opportunity to deliver that information and make certain that we can have folks digest it. It took me a while to figure out that word digest, I guess, but also to make certain that we deliver it in a compliant fashion. I mentioned that they have choices. We have the different election periods that we go through. We have a ton of different special election periods that enable people to change throughout the year. So some folks, if they come into the Medicare market and they're not particularly active, they may think, well, after the annual election period, there's not much we can do. Well, you look at the number of special election periods and the special election periods that the different carriers speak to us about. Well, the majority of people on Medicare can still make choices throughout the year because they qualify for that special election period. And so what we wanted to do here at Premier is make certain that you're aware of the opportunities that you have with the carriers with whom we associate, but also those that partner carefully with us and deeply with us and deliver upon not only the plan benefits, but also the wherewithal on the back end to deliver upon those benefits. You have a great looking car, have it sitting in your garage, you don't have gasoline to power it, the car's not worth much. So we want to make certain that we deliver upon a program that not only delivers benefits, but takes care of folks in the fashion that we expect of our partners. And so we've asked our friends over at Anthem to come on and visit with us and speak to us about the programs that they use to help us be more effective in this space. And so at this particular point in time, I'm going to introduce Veronica Zarita and ask her to come on and visit with us about the Anthem Advantage. So, Veronica, I've turned helm over to you. Here we go.
All right. Thank you, John. My name is Veronica Zarita. So I'm one of the regional sales managers here in Northern California. Very happy to be here. I am going to walk through Custom Point. So if you guys have heard about it or have not, we have a lot of amazing stuff on this portal. I'll briefly go over what's in it because I will do a live demo, walk through each category so you guys know exactly where everything's at. So Custom Point primarily is known as where you order kits, right? Your Medicare Advantage, DSIP, MedSup, but it actually has a lot more. It has a lot of marketing material based on product, based on county. We even have postcards, flyers, posters, a lot of marketing material that is already CMS approved with benefits on there, right? And also it comes customized. So once you create your profile, which I will walk you guys through, once you create your profile, all of the materials will have your name, your phone number, your license, as well as your email address. So everything completely comes customized to you. Here at Anthem, we do understand that marketing materials can get very expensive. You can order 200 per month per item, but of course, if let's say, for example, you have an event that's coming up and you need, you're doing a food drive or you're doing a special event and you need more than 200, please let your regional sales manager know so we can get that approved for you. But automatically, you can go in there and order 200 per item per month without needing any approval. So definitely make sure that you guys take advantage of it. I know that we're one of the, I think, the only carriers that actually let you go in there, place your orders. Most of your marketing materials does arrive in about a week or two, and it's ready to go. So really nice quality. If you look here on the home screen, I will provide you guys the link after to John so that you guys can have it. Once you log on to Custom Point, if this is the first time you've logged on or you haven't logged in a while, when you first become ready to sell with Anthem, in your ready to sell email on the bottom, it will actually have your user ID. So your user ID is unique to you. If you can't find your ready to sell email, you can always reach out to broker support to get it. The password, of course, is unique to yourself. And then for the account on the bottom, it will always be WPSS. So let me go ahead and log on. All right, so once I log on, this is what it looks like. Welcome, Veronica Zarita. First thing you want to make sure is that your profile is accurate. Things change, whether it's phone numbers, email addresses. So first thing is go into your profile, right? Make sure that all your information is correct, your name, email address, phone number, or if you need to reset your password. Also, too, if you do have a professional picture, I do encourage you guys to upload it to your profile. I need to do that. I just recently updated mine. It does have to be a professional picture. Once you upload it, it takes anywhere from 24 to 48 hours to approve. Once it is approved, it will actually print on your marketing material, right? So I always encourage you guys to use a photo if you have one, just because a lot of people, especially seniors, they may or may not remember your name, but they'll always remember a face, right? So you want to make sure that you have that picture uploaded. It's very easy. Once you make sure that all the information is correct, right? Your address, everything, you can go ahead and begin. So as you can see, I order a lot of stuff. So this is the welcome screen. For kits, so right here in the middle where it says quick find, what materials are you searching for? We have a category for everything, right? So let's start with MAPD enrollment kits. So if you've never ordered kits, this is how you would do so. If you have a license in multiple states, it will list all your states as long as we have that information. I'm licensed in California and Nevada, so let's do California. Once you select the state, then it'll have you select the county. So let's just pick, let's say I'm in Fresno. We're going to select Fresno. Once all the items are populated, you're going to click Find, and it's going to bring up every MAPD product available in that county. One unique thing about us is that we do have several languages depending on the area. For example, in the Fresno County, it is primarily English and Spanish, so we do have those kits available. So for those that speak other languages, we have Spanish, Vietnamese, Chinese, and Korean, I believe. So we do have a lot of languages depending on the area and the demographics. So here you can actually filter by language and plan type, but when you first log in, it does list everything so you can look it over. Let's say for myself, I'm looking for English, and I'm going to get ready for a strong lock-in period, right? As soon as OEP is ready, I'm going to select those DSNPs. Here, it'll let you know the service area, make sure it's the right kit. It even gives you a little preview. What you do is you go ahead and put in your quantity. So let's say, for example, I want 50 or 100, whatever the case may be. You go ahead and just like Amazon, right, you click order, and it'll take you to the next screen where you can put how many you want. You can actually, on all the materials on our page, you can actually get a PDF copy as well. So if you only want the kits, you would select print delivery. If you want the PDF as well as the printed kit, you would select them both, right? Then you go to continue shopping, and it'll take you right back to the window where you were at. Let's say you want to go back to home, right? You're finished ordering kits. Then you go into, it'll take you back to the MAPD portion. Here you can change the county. I know a lot of you guys work in multiple counties, and some counties are very close to each other. So here it lists all the counties that are available in that state. So if you don't see anything, please reach out to your local manager. But for the most part, everything is in here in case you need a quick PDF or the actual physical copy. Now let me go back to the home screen. So we just went over the kit portion. The second one would be MAPD sales materials. This one is important because this has all of the marketing materials specific to each county, because as most of you guys know, the benefits are different from county to county, and some are very similar. But the reason we separate it by counties, you want to make sure that you're compliant. Everything has been submitted to CMS. Everything is CMS approved. All of our marketing materials do come with an approval code at the bottom. So you're always compliant. You don't have to worry about, was something filed? Is this piece compliant? Everything is ready to go for you guys, right? So we're selecting MAPD sales materials for California, and I'm going to do Kern County. I'm going to select Fine. Here, it's going to list everything that is available. If you take a look to the left, you can choose by material type, language, and plan type, right? So let's say, for example, you want to do a mailer, right? We have a lot of different postcards, depending on what you want to focus on. So this is one of the postcards. This is a universal one. So if you take a look, you can select show full image. It'll let you see what the postcard looks like. These are all ready to go. And of course, once you add it to your cart, all of your information will be there: first name, last name, phone number, as well as license. So definitely for those gearing up for a strong lock-in period, because, you know, before we know it, it'll be here. Make sure you order these, right? As many as you need so that you can get that going. And then let's go back. took me all the way back. So besides the cards and the postcards, we do have flyers, right? The flyers are very popular because they're based off benefit, right? So say, for example, you want to focus on over-the-counter. Our over-the-counter, is unique because you can go in store, over the phone, online, and it actually lists the highlighted benefits. So let me click on it so that you guys can see it. So this is what the OTC flyer looks like. And these are good to have around, if you're working with a pharmacy, if you're working with the doctor's offices, whatever the case may be. Let me make that a little smaller. And you can actually select your different photos, which is nice in the process. And I'll probably walk through that right now. Here, for that specific county, because I did select Kern County, it'll let you know, it'll highlight what the allowance is per year. So stay healthy with up to $1,600 a year for over-the-counter items. It does list some of them, also the different options that they have to order, the OTC, and then of course your information. And then if you do speak several languages, you can actually put those on the flyer as well. And then of course the back is the disclaimer with that approval code. So definitely that will put a lot of you guys at ease. All of our materials are CMS approved. So let's go back. Let's say we're adding this, right? I need 200. I'm going to drop these off at a doctor's office. You go put the amount, customize. Here is where you would put the plan details, right? So because we chose Kern County, it lists the Dual Plus, which is one of our popular D-SNPs. You select the yearly amount. Here is where you select the picture. You have the option to customize, right? Depending on which one you want. I like this one. And then we go down and make sure all your information is correct. First and last name, phone number, your license number. Make sure you put that in. The different languages that you speak, because I know a lot of you guys speak a lot of languages. And here you can choose to include your picture or not. I haven't uploaded mine yet, but definitely want to make sure if you have a picture that you uploaded it in your profile beforehand. And then of course, once all that is filled up, you can go ahead and click add to cart. Next, let me just put my license so that you guys can see how easy it is. Click next. And here's going to let you see the proof. I've read all proofs. And you add to cart. Very easy to use. Our custom point is step-by-step window-based, so it's very user-friendly. So I personally like it because it lets you add. And then, of course, with the flyers as well, if you want to save the PDF, which I always encourage my brokers to do that, select print and e-delivery. And then usually within an hour or two, it sends you the PDF where you can save it on your screen. So let's say, for example, you have an event that pops up last minute and you need 300 flyers. You have the PDF where you're able to print them yourself in case you need them sooner. But definitely, I hope that you guys after this call will go in there and place your orders. You guys can have all this marketing material ready. So in those events that do pop up at the last minute, you guys can go ahead and participate and have marketing materials. So besides the over-the-counter, that one's a really popular one. We have a dental flyer. So for those of you that work with dentist offices, that network with dentist offices, we have flyers, we have posters that they allow you to leave them at their offices. I would do so, have them printed. We also have a vision flyer. So one thing that I've noticed a lot of brokers are doing, and things that I used to do in the past, is I used to work with vision providers that were within our network, right? And would network with them, bring them lunch, have them, see if I could leave my flyers, my marketing materials there. And that did create a good lead generation for myself. We also do have the hearing aid flyer, the universal flyer, And then here we have the different languages, right? So let's say, for example, let's choose Spanish. So if there's a specific language that you want to focus on, you can go ahead and select that language so you see which materials are available within that language. Plan highlight charts. This is one that I personally like because it has the benefits, right? So let's do English so that everybody can read it. The plan highlight chart actually has all the benefits in a trifold. What I mean by that is, let me go ahead and select it so you guys can see. It has the MOOP, what the copays are, what the benefits are. It's a really neat thing to have. Not showing on this, but I think we have to download it. But this is a trifold that it comes with the highlighted benefits in the front, right? So if they have Medicare and Medi-Cal, and inside it actually shows the copays, what the OTC allowance division, the different essential extras that are available, pick one or pick two. So definitely, I would encourage you guys to order these because it is county specific. So if you work in a specific county or you're looking to grow in a specific county, it does have the plan highlights. So let me go back. And then also too, the posters are very nice because they're larger. If you're leaving them at dentist office, like for this area, we have the dental poster that's available, right? And they're pretty big. They're regular poster size, which is nice. And if you're networking with somebody that'll allow you to leave these posters, right? So this is a good way for you guys to network with dentists. And then based on the benefits, it will highlight, dentures, crowns, extractions, what the allowance is, cleanings. It'll auto-populate all this depending on the area. And of course, it has your information. But this is just another way for you guys to get more exposure out in the market and get those leads. So our marketing material does make it really easy to catch the members' eye with their marketing materials. Most members in public know about Anthem, so that's really nice. So that's that poster. So let me go here. So that's pretty much it, depending on the product and county. But let me go back to the home screen. We also have let me see. We also have PDP sales materials and enrollment kits. So if you do a lot of METS-up, you want PDP sales materials and enrollment kits, we also have that. We also have a section for Medicare supplements, right? So Medicare supplements have their own marketing materials as well. So if you are a METS-up producer having METS-up, we have a lot of materials for you guys as well. Not just the sale materials, but also the different Anthem extras. We have our standalone vision and dental plans, so we do have the marketing materials that accompany that. We do have brochures, cards, and flyers, as well as the different forms. So here's a popular one, the agent flyer. If you're looking to leave these materials or you want to do a mailer, we do have the postcard. So new to Medicare flyer, let's click on that one. So the new to Medicare flyer, we do have different ones, and they're really customizable where you can change the picture and sometimes even what the header says. So here's one example, something a little smaller. Say with our new to Medicare discount program, right? And it highlights the Plan G, the different discounts that we have for new to Medicare. Don't forget, we have 10% household discount for this year, and all the different options. So there's this flyer. Everything comes, already with an approval code, which is nice. And then let's go back. And here is I like this one, METS-up at a glance too. It's similar to the benefit highlights, but it's for METS-up specifically. And it'll highlight it. So let me have it load. So here's the front of it. right? Find what you're looking for in a Medicare supplement plan. And then on the second page, it highlights the different options that you have regarding, the freedom to choose, access to Silver Seeker Fitness, the new to Medicare discount. So these are nice. And then we also have the postcard. So really depending on what you want to focus on, whether you want to do a mailer, whether, you want to have marketing material with your information on it at different locations. We pretty much have marketing material to accompany most of the projects that you would have in mind. And this is what the postcard looks like. I know the new to Medicare are very popular, especially you want to grab them when they're new to Medicare and turning 65 for those meds up. So this is what the postcard looks like. The back, the disclaimer. Here is just kind of highlighting the meds up and the different things it has. So let's go back. And we also do have different languages as well, depending on what you want to focus on. So those are the different languages. Definitely encourage you guys to go in here and look through everything. But a lot of different materials. I know personally myself, when I used to sell, I used a lot of these to, market myself in the counties. We also have lead generation marketing support that is specific to lead generation marketing material. Just keep in mind these are updated. So what we have now, more will be added later. So they do update these regularly. So we have a member retention postcard. We have Medicare 101 presentation, right? So if you're going to be doing presentations, everything in this category is to help you grow in the market, right? So whatever you would need, not only to retain referrals, presentations, consent to contact cards, everything is in here. Thank you cards, birthday cards, even event sign cards. So if you're not sending birthday cards, I would encourage you guys to do so. So here at the top, the member retention card. This one's popular because you want to make sure that you are reaching your members, at least 2 to 3 times a year. If you take a look, it says thank you for being an Anthem Medicare Advantage member. And then, of course, it has the logos if you have any questions, and then all your information. So this one's nice to send out with a birthday card. All right, once we go back, here is where the rest of the stuff will be. Just like I said, just depending, everybody has different strategies, things that they want to do within the market, but we do also include one neat thing about, and that was for the birthday cards, we actually include the envelopes, which is nice. If you need consented contact cards, we have the physical cards that come in the mail. We also have the electronic version as well, and also in different languages. Let me just do English, so that way it's less stuff on the screen. Also, Medicare 101 presentations, if you don't have one, we have one available for you guys to download. The print ad, we actually have a print ad ready to go for a newspaper. So if you're looking to do newspaper, we do have a pre-approved newspaper ad ready to go. Let me see if it'll open so you guys can see it. Oh, and this is what it looks like. And like I said, always include your picture if at all possible to market yourself. So this is what it looks like. So it's really nice and all ready to go. And then let me go back to so that is what that portion is. This one's the lead generation marketing support. So we do have a lot of different things, sales presentations, Medicare, Medi-Cal, postcards with the pictures. I would encourage you guys to order this one because it has a larger picture of the Medicare and Medi-Cal card. So if you're doing events, you can display those on your table. We do have generic Medicare as well as MA posters. But these referral ones are actually really neat because you're sending them out to your current clients asking for referrals. right? So if you have questions about Medicare, I'm here to help. So these are the referral, and if you have a friend, I think I clicked on the wrong one. Let me go back. Oh, referral trying to reach you card. Okay. So like I said, we have a lot of different options depending on what you want to focus on or how you want to market yourself in the county. But a lot of different materials. We even have a veteran flyer depending on the area that you're working on, turning 65, of course, the general information. And then let me go back to the home screen to see what else. So after lead generation, we also have different social media. Let me click on that one. Let's see, for California. I know our way of selling changed after the pandemic. So a lot of seniors are online more now than ever, especially Facebook, right? So if there's a specific art that you want to focus on, HMO or PPO, we have the Facebook marketing materials to go with it, right? So you can actually download these, which is really nice. And then let me go back to them and see what other ones we have. Like I said, they're constantly adding more stuff. So check in here, every month and a half to see what else we have added. Depending on the message, there's even this one, right? Would you like a one-on-one review of your Medicare options? We have this as well. So really depending on the message that you want to, put out there are different social media platforms where you can advertise or have your own business page. But there's a lot of materials for you guys to use for that. So let me go back. So after the social media, there are different directories and hospital flyers you can order. We also have different forms. So the forms are anywhere from the CSNP pre-qualification forms, the Anthem extras, anything like that. A lot of those forms are available here in Custom Point, and even the essential extras, which is our big thing this year with Anthem. We have them in different languages. So these are all the forms that we have. Let me go back. So after the forms, we also have formularies. So if you want a printed formulary, you can order it. But of course, we also have the PDF that you can save on your desktop. But if you wanted a physical copy, you can have one. This one I really like because it's the catalogs, not just the OTC, but the assisted devices, because it actually lets you, this is what the members get in the mail, so let's do English. Unfortunately, this year our catalogs don't have pictures, but it does have them listed. So let me take a look. This is what the catalog has. I know with my trainings, I give them to each of the brokers so they can see the most commonly OTC items that are available. And then also we do have the assisted devices. That one is for more of our simple DME items, right? Canes, walkers, compression box, wheelchairs, things like that. Definitely encourage you guys to order some to have handy in case you need them for sales events or even just to show or walk through members. A lot of seniors tend to be very visual, so we do have a lot of materials that can kind of help with that. After the OTC, we do have the plan star rating, so in case you guys don't have the most updated star rating, you can order that. Provider co-branded materials, we have those in the area. Those are more RSM specific, so just check with your local RSM regarding that. But for the most part, these are all the different items that are available for you guys to order. I pretty much went through all of them. But like I mentioned, make sure you go in here and place your orders. We have tons of materials to help you in the market to generate leads. And then if you're working with a lot of different doctors or some of our vendors, you definitely want to have marketing materials out there. So we have pretty much marketing materials for most of our benefits as well as our ancillary benefits. So we have that. But like I said, it's very easy to use. You can always check on your orders as well, do an order search. But please make sure that your profile is up to date before you place your orders. That way, all the marketing material that is printed is accurate and has the correct information and name. Normally, the marketing materials do arrive in about a week or two. The turnaround time is really quick. But that's pretty much it for me. Are there any questions in the chat? I haven't taken a look.
Veronica, I think I thank you once off the top to demonstrate. I mean, you've demonstrated the power of the systems that come with an association with your organization, and the fact that folks don't have to recreate the wheel, which has always been a point of frustration for many folks, where they think, well, it's not there. Well, you haven't looked in many circumstances, and you really have a preponderance of information that's really demonstrates that the material's there to help people get in front of folks. I mean, you guys have a great benefit package. You have a strong network. And what we've done today here is demonstrated that you have the marketing material to help get in front of folks to actually sell those programs. The question I think that would come to mind most would be, in your particular market, what do you see as the tools that are being used most frequently? And are there any things that you would recommend that people have as part of their portfolio of marketing material?
So in my area, a lot of my brokers utilize the T65 materials. Some of them purchase leads or have generated leads, so they do send out mailers. So I highly encourage you guys to order the postcards as well as the flyers. And then a lot of my brokers do work the D-SNP market throughout the whole year. AEP and OEP is over. A lot of my brokers work most of the year, so they do order a lot of the D-SNP materials to have at different offices. But one thing that's really worked in my area is that they look up our vendors, our locally contracted vendors, right? Who our vision providers are, who our hearing aid providers are, and they will print like the hearing aid allowance here in Northern California is $3,000 per year. So they will team up with our hearing care solutions vendors locally and place those materials there. Senior centers, local, businesses that do not do Medicare. So they really have a lot of those materials out in the market, and it works.
Awesome. You can see as you go through your demonstration that these do appear to be market-specific materials as well, and I think that's a great advantage to you. One of the couple of the things that you noted on this were information about providers, and are there programs that you work that help agents become involved in that market, be it with doctors or dentists, or how do you help people become engaged in that market?
Yeah. So for Northern California, I work very closely with my medical groups. I work very closely with our vendors, like our dental here in Northern California is Liberty. I do work closely with the rep. So a lot of the things that I do locally, I invite a lot of my medical groups and vendors to give my brokers exposure to them, where they can network and, start doing lunch and learns with said providers, with a lot of the dentists that are within our network. So that's what I do here locally. I can't speak for my counterparts in other states, but I know for myself, I do work very closely with our vendors, because there's always an opportunity for to network and produce leads.
Awesome. You mentioned too that many of your agents are active in the D-SNP market, the dual special needs programs that are out there. It's a market that I am really close to my heart, but one of the things that I would ask of that is, if an agent looks to become more involved in that niche market within the Medicare world, do you have different trainings and other things that are set up that can help us, in addition to the marketing material, to make certain that we present your programs as they should be presented?
Yeah, absolutely. So each RSM, I know for myself, I have 2 different webinars a week and then also in person. Now that right now we're doing a strong OEP push, but we do have our DSTEP training available not just online, but also in person. With a lot of our counties, there are a lot of Medi-Cal changes coming up. So I have been doing a lot of training when it comes to Medi-Cal. Anthem, as you know, we are very strong, not just in Medicare, but different lines of business. We do have a strong Medi-Cal, Medicaid presence. So with that being said, a lot of the markets, we are the Medi-Cal, Medicaid provider for those counties. So with a lot of the realignment that's going on within the next couple of months that actually started this year, we're doing a lot of in-person training so that the brokers understand, how everything is being coordinated. Because as a broker, you want to make sure that you align yourself with a health plan that also has a Medi-Cal contract, especially, with a lot of the changes coming. So each market is specific, but I know for NorCal, for myself, Anthem is in a very good position when it comes to our Medi-Cal business and our Medicare DSNP. So they're very strong plans, and a lot of our Medicare and Medi-Cal plans do align. So that's very important.
Awesome. That was my next question. How you guys are addressing the contraction of some of the Medicaid benefits that are in the news and in the line of sight for some of the folks that we deal with. So thank you for that. So that seems to cover a bunch of the questions that we have. What I'm going to do now is pull back some control of the system. And thank you, Veronica, for the presentation, by the way. But kind of finish up as to why some folks want to do these types of programs with Anthem through Premier. And we want to make certain that folks realize that we deliver upon additional means of support as well that kind of dovetail into today's presentation. And that includes making certain that you're properly contracted. We have an opportunity to use a software system where you can create your agent profile, contract with multiple organizations quickly. But as a part of the new normal that we have, the world that we have, we start the entire process with electronic contracting, and we do so specifically with Anthem to make certain that we can get you up and running as quickly as possible. We do deliver discounted errors and admissions coverage for qualified agents. What makes you a qualified agent? Well, you got a contract with us, but this is a program that you own. So Premier's huge. We have a huge footprint. We have a lot of programs that are out there, but we don't have everything. I don't know of anyone that does, but this program is one that satisfies the requirement that insurance companies have for you to have errors and admissions coverage, and you own it. So it's not like being added to a blanket E&O policy for just one program, and you wonder how to handle the rest. Very economical in price and great coverage that comes along. We also offer discounted continuing education programs through our association with WebCE to make certain that your license stays in play. And as an independent agent, you are responsible for your own benefit package. So we've made available a modified guarantee issue disability income program that you take out on yourself and you're paid a commission on. Much as where I mentioned at the beginning of today's broadcast, so to speak, that the presentation is being recorded, past presentations have been as well, and are located on our website and on our YouTube channel. But some of the topics that we talked about today, if we look at how you approach the DSNP market, how you work with providers, one thing we didn't mention was retail. Some folks think that it ends at the end of AEP, and it doesn't. There are some things that we can do to still increase the return of our investment in that. So different topics of that nature are made available to you in our video library 24/7, a great way to take the information we learned today about Anthem and the marketing programs that support that they have, how we can tie that into some of the detail made available to us in previous presentations. We do also make certain that we make you aware of all of the incentives that are available to you. In the Medicare world, Medicare Advantage and PDP plans, the max comp is set, so you don't see carrier incentives in many cases for that. But Anthem has a very strong Medicare supplement program. Periodically, Medicare supplement programs will have carrier incentives. Sometimes that helps them qualify for trips if the carrier offers it, but it also offers you an opportunity to qualify for additional incentive programs through Premier. And that includes the return of our producers convention. Took a bit of a hiatus because of the pandemic, but it's back, and it's a great program available to agents that you can qualify for based on sales in different categories. Once again, boy, I kind of left this slide in there. I'm so proud of our programs that I have it in there twice. You have access to those recordings 24/7. One of the things I really want to make certain that agents are aware of is the fact that they have complimentary access to Medicare Center. And this is a tool created for the agent that gives you access to multiple quoting engines through a single login powered by Connexure, Sunfire, CSG. And those programs then give you the opportunity to collect a scope of appointment, record calls, stay compliant in reaching out to people, and provide side-by-side plan comparisons for folks that you're visiting with. It also gives you the opportunity to take advantage of a PURL, a personal URL, a microsite that gives you a presence on the web as well. I mentioned earlier that Deaf Research tells us that folks are doing shopping ahead of time. This is a great way for you to put a link in your email or on your other website if you have one. That gives folks the ability to go shop with the programs that you offer, making certain that you have Anthem as one of those carriers. It also provides a contact management system for you, a CRM, so you can not only easily do the year-over-year reviews, but reach out and touch the folks throughout the year. Veronica mentioned you should do that at least 2 or 3 times a year. Totally agree, but it also gives you an opportunity to cross-sell. So keep that in mind. And within that system, it comes with switcher tags. What is that? Well, that's a notification that tells you that this particular prospect or client may be more likely to change their coverage. So it gives you an opportunity to prioritize your outreach there as well. We'll talk about Lead Center in just a moment, but the program also has Learning Center resources. So we've got a great carrier that we work with. They give you great benefits, strong network. They do some marketing support. We've got a lead popped up. Well, if we are able to close a greater percentage of those leads, we're ahead of the game, and using resources within the Learning Center helps you do that. The program is available in a mobile application, and as one of the quasi-celebrities says in one of the TV commercials that we suffered through endlessly, it's free. You don't have to pay anything for this as a contracted agent with Premier, one of our integrity partners. We do want to make certain that we can get you in front of people, and that includes a number of different lead sources, such as a custom list that's ordered specifically for you. This is for folks that still smile and dial. You can do that with MedSup. You can't with MA or PDP programs, but keep in mind, one of the things that we've encountered with this over the last recent history is the size of those names that are available. The number of names is decreasing because of the popularity of do not call lists. I'm on them. You probably are as well. That really shovels down the number of folks that are available on some of these lists. However, we want to make certain what we stay compliant, so we do butt it up against do not call to make certain we keep you safe in that area. We do have special programs that are set up to help you be successful in community marketing, and that includes marketing through retail opportunities, faith-based organizations, and provider marketing. So we have specific material out there in those areas for you, and they are part of that video library that I referenced earlier. Carriers do sometimes generate prospects for us, but this is kind of a quid pro quo situation. You scratch my back, I scratch yours. It's not fair for an agent to go to a carrier that they haven't done any business with and say, hey, what do you got for me? Gimme. Work it back and forth, and you have then an opportunity to create a relationship with strong regional sales managers such as Veronica and different people with carriers that can help you in that regard. Internet social leads, direct mail support, lead center, T65, and referral programs. Let's talk about them specifically. The mail program is a discount program based on production, drives down the cost of the mail, gives you the opportunity to make certain that you have the ability to do things consistently. Direct mail is kind of like working out, exercising. You do it once, it might make you feel kind of, oh, I did something, but you don't see the full value of it if you don't do it consistently. So this helps us do that, and we do so through vetted lead vendors that have systems to deliver those responses back to you as quickly as possible and are procuring those leads for you in a compliant fashion. And what we see with many of these carriers in the discussion or vendors at this time is the carriers will see greater response with specific campaigns at different times of the year. And much as what we saw with the demonstration today, where we don't have to recreate the different pieces, that's the same thought here. We have subject matter experts that have put things together and they have compliant outreach for you. We do also have other opportunities for you to fill your schedule. One of our partners delivers upon different Medicare leads available for purchase. That, well, fill holes in your calendar, do so economically. If you don't have the dollars to put together an entire mail campaign, or you just want to fill some holes in the scheduling, this is a great way to do it. These are direct mail responses that have never been touched and periodically come on sale, as you might note here. So something to consider. Lead Center, it's part of the Medicare Center, but it's the program within that system that enables you to access leads that are procured through multiple vendors, and it delivers upon a lead source that you can access either through a live transfer or for information within the CRM that is delivered upon for you. Cost, well, that's up to you and how you budget for it and how you deliver upon it. You can turn it on and off as you wish. A great way to make certain that you have a constant flow of leads into your agency. One of the internet lead programs that we have delivers upon leads in both final expense and Medicare. One of the things that we see on Facebook leads as this program is you can get a really quick response. But they expect a really quick response from you as well. So you want to be really on your toes with an internet lead program to make certain someone doesn't beat you out on it. We have introduced too a new lead program that deals with generation through search engine optimization, another internet lead program that your premier marketer can help you with in determining costs and other aspects of this program that can make you be very successful very quickly with that. The T65 locator is another tool that's made available to you without cost. You register on a smart device, be it your phone, your laptop, your whatever it happens to be. They investigate, they find you have a contract with us, and you then have access to this system that you can set parameters where you can actually define where some of these people live. And for folks that are stacking appointments, face-to-face appointments in an area, and one cancels, this is a great way to help you fill in that time compliantly with different programs that allow you to perhaps door knock. Referral program, well, it's important for us to take one lead and grow it, cast your bread upon the water, so to speak. And that is a vital part of our sales process, but it's also a vital part of keeping our book engaged. Veronica mentioned we should reach out to our folks a couple, 2-3 times a year. Well, if you do so, and you should, you do so with a purpose. And when you approach your book of business, then you're able to say, hey, I've got a dental program that's come available to me. It's very strong in your area. We want to make certain that we can help people with it. Who do you know that I can help in that area? You're not directly asking your book of business for business, but what's the first thing that pops to their mind? Well, hey, what about me? So a great way to continue to engage your book throughout the year. We do all this simply because we want your business. We want to be referable to you, and we want to make certain that we offer programs that you can engage very quickly. Veronica's demonstrated with great aplomb today that there are things that are out there within their systems that can help you drive business to yourself and your agency. And you can make it part of your personal marketing plan very simply. You're contracted and certified with Anthem. Go in and use the tools they have available to you to drive business. So I'm going to check really quickly to make certain that we cover the questions. And it appears we have. So at this point in time, what I want to do is, for folks that have worked with Premier in the past and you're viewing today's presentation, I want to thank you for your business. Genuinely appreciated. We hope to deepen that relationship through the association we have with you and strong carriers such as Anthem. For those of you that are just checking us out, thanks for the opportunity. We look for the forward to being able to earn your business moving forward. But since I really appear to really like to talk, I've taken a bunch of your time today. I thank you for that investment of your time. It's a great help for us to make certain that we have people that come on and take advantage of these opportunities to learn more about different situations that are presented to them. And I thank you for doing so. So at this point in time, Veronica, thank you once again for your presentation. Very helpful. We look forward to being able to drive even more business for our mutual benefit. Thank you for that. For everyone else, until we're able to visit with you in the very near future, I wish you good selling. Thanks so very much. We'll talk to you soon.